Hey guys, another Hopper hot take tonight. This one's gonna be a little bit longer than normal videos, I think. Um, so here we are. What? 8 weeks, 9 weeks, 10 weeks. I don't know what month is it. Into this whole COVID thing and the pandemic and stay at home, and I know a lot of places have started to open up. Texas has started to open up, whether people like it or not, or it doesn't matter. But one of the things the pandemic has demonstrated is how important the school system is in America. And I think everybody understood that it's important, right? But I don't think people really understood how important the education system is, not just for learning, but for so many other needs that our education system, whether in a public school or a private school or charter school, whatever, is providing for students on a daily, weekly, monthly, and yearly basis. From meals to social help to technology to healthcare, and it's in so many different ways at so many different places. But tonight I want to talk a little bit about healthcare. And my friend TJ Morgan posted on a comment yesterday in a Facebook group of athletic trainers, and his comment was that student health and athlete health and just healthcare in general, we know is not good, right? And it's so undervalued in the school system. Again, whether that's student health, if a kid shows up and goes home at 3 o'clock and doesn't participate in any type of activities or not, or whether that kid is a future Division I athlete, right, and participates in multiple sports. The healthcare that we provide our students is lacking in so many different places. And I've been an athletic trainer now for almost 10 years, and I've spent essentially all of that in the secondary school system. The first 3.5 years of that was in working for a PT clinic and working outreach at 2 separate high schools during that time, and now working at Bishop Lynch and being a school employee for the last 6 school years. That's quite a bit different between the two environments. And we're very fortunate here at BL. We have 2 full-time athletic trainers and a full-time school nurse, and we work really well together. We have great physician support from our team doctors, whether that be orthopedic or concussion. We have great relationships with some physical therapists. Again, we're fortunate, and that helps us provide what I consider to be pretty good health care for our student athletes and our students in general, right? And for our faculty. But what this pandemic is going to demonstrate is how undervalued that is across America, in that there are a lot of schools that are going to try to start athletics in the next several weeks, months, whenever that time comes in their particular region or state. And they're not going to have a healthcare provider there. And they're going to be making decisions based on what coaches and administrators are saying. And they're going to have coaches and administrators making decisions that, they probably shouldn't be making. And those become public health issues, potentially. Outside of that, at some point, schools are going to try to go back to school, right? They got to get back on campus eventually. And there's a lot of talk about what that's going to look like and when that's going to happen. And there's so much planning in so many different schools across the country right now trying to figure out how to make that work and be safe. And, the school nurses, where a school has a school nurse, is involved in that plan. I've heard from a lot of athletic trainers that they are involved in the planning, and we are here as well. Again, both from an athletics perspective and from an academic perspective. But there are a lot of schools that don't have those resources, and that's something that's got to change in America. We've got to find a way. Right now, the most recent research from the Corey Stringer Institute says that only 35% of high schools in America employ a full-time athletic trainer. 31% employ a part-time athletic trainer in some capacity, whatever that means. And we still don't know what that means. But that means that 34% have no athletic health care whatsoever. Now, I didn't look it up, and I should have. But the National Association of School Nurses, had to think of the name for a second. The National Association for School Nurses has also done some research. And I don't remember the exact numbers, but they were around 35% having a full-time school nurse too. And that's, again, that's a scary thought, right? You got a lot of kids who are showing up at school every day where there's no health care. And, we have to remember that at a normal time, kids are spending 8, 9, 10, 13 hours a day at their school. We have athletes who show up at 7 a.m. and are still on campus at 8, 9 o'clock at night. And they are at school the entire day. We've got to be able to provide them with some form of health care in that process. Right? Even a regular, normal school day, a kid, again, shows up for the first bell, leaves after the last bell of the day. They're still there for 8 or 9 hours a day. Who's taking care of them? In many of our schools, there's nobody. Okay? Again, now you've got a teacher or an administrative assistant or a secretary who might be handing out medicine or, trying to decide, well, do we need to call the parent, or do we need to do this, or do we need to do that? And that's got to get better. And again, this pandemic is about to demonstrate in a lot of ways how undervalued the student health system is in America. And you're going to see it with all the restrictions and guidelines and policies and procedures that are going to be coming into play across America in the next few months, to make sure that our kids and our teachers and our faculty and staff are taken care of. Healthcare is going to become that much more important in the lives of our students. And I have heard that there are some schools who are adding nursing staff. I think that's great. Be curious to see how long that nursing staff lasts, right? Or is that something that's going to be cut right away? But at the same time, when we think about athletics, we need to start thinking about that too. And we've got to get better than 35%. In America, in the American education system, 35% is failing, by the way, in case any of you didn't realize that. And even when you take 35% and 31% with our part-time, that's still failing in most cases at 66%. So we've got to do better. Again, I can sit here and I can tell you, remember, every three days in America, a student collapses from cardiac arrest in a school environment? Who is there to take care of that child? Whether that child is in math class, or that child is playing football, or volleyball, or a cheerleader, who's taking care of that child? We have to do better. We have got to put a greater emphasis on student health care. It's 2020. It's time that we wake up. It's time that we start taking care of these kids.